things I know I should be doing.
Morning, Richland County. It's 9:30 a.m. on Tuesday, March 21st. My wife's birthday.
Happy birthday.
See, I didn't forget. I'm Mercer County Commissioner Cliff Mears, joined by my fellow commissioners, Tony Vero, Darrell Banks, our clerk, Stacy Crawl, County Administrator Andrew Keller, HR, Kelly Christensen, Central Services, Rachel Troyer. We have Wendy from Sebco to give us an update on things. And from the media, we have Greg Kale, WMFD, in person, live. And on the line, we have Carl and Al, Person Source and the News Journal, respectively. Our first order of business is to turn the show over to you and update us on what's happening at Sebco.
You can vote.
Oh, yay, I'm on camera. Well, I brought you third and fourth quarter because we didn't come out. That's fairly typical that we don't make it out third quarter, always during the time that we're doing open enrollment and other things. I'm not going to go over the third quarter reports, but I brought them so that you have them for your files, so that you have the consistency for the full year. What we're going to go over is the fourth quarter, which is the end of the year for 2022. And that's the report that should be on top to look at. So when we're looking at a running 12-month on this is the full year, January 2022 through December 2022. And so the year to date and the running time frame is going to match up on this. So your medical loss ratio for this time frame is 98.6. Your prescription is 106.2. Your medical and prescription together are 100.4%. So what that means is for every dollar that we're taking in premium, we're paying $1.4 out in claims. Your dental loss ratio is 85.5%. And we're starting to see the dental level off. If you'll remember, it kind of tipped up a little bit toward the end of 2021. And that was really to compensate for people not going to the dentist during COVID and then trying to get some things done. We're now seeing those kind of leveling off with most of the counties and returning to a little more ratio. I can't say that we're seeing that necessarily on the medical. We're still seeing some things on the medical that may be a little higher than normal. And it's usually for those things that maybe you put off that are called elective procedures, but really aren't necessarily elective. They're those types of things that you can schedule, like knee replacement, hip replacement, that you were not really permitted to do for a period of time in 2020 and early 2021. But now people are rescheduling and getting them on the books. So looking at your enrollment, and this is the average for the year. For your employee-only tier, you have 237 employees enrolled. For the employee plus spouse, you have 93 employees enrolled for 186 members. For employee plus child or children tier, you have 144 employees for 409 members. And for the family tier, you have 97 members for 389 members. Your total employee count or average for this time is 571, and your member average for this time period is 1,221. And then taking a little deeper dive into your membership, the demographics of it. 53.7% of your membership is female, 46.3% of your membership is male. The average female employee age is 47 years, 9 months. The average male employee age is 45 years, 2 months. The average female member is 36 years, 4 months. The average male member is 33 years, 9 months. And looking at when you're comparing you to Sebco overall, you're right in the middle. That your ages are smack dab in the middle as far as your average employee and your average member. If we flip over and we look at your medical and pharmacy age count summary, per month.
I'm sorry, can I interrupt? Can I ask a quick question? Just so I understand this. With your enrollment, total members is 1221. The member count 6.
Yeah, well, what I will tell you is Anthem, when I'm pulling this report, Anthem is looking at the specific fourth quarter, whereas when I'm looking at your membership, I'm looking at the full year average.
Okay, so that's where the discrepancy there. Okay, thank you. I'm sorry to interrupt.
So looking at this on your medical and pharmacy summary, 457.82 per member per month on medical, 47.70 per member per month on prescription. Together it's 605.55 per member per month. For when you break it down to that smaller number of the per employee per month, it's 979.18 on medical. Per employee per month on prescription, it's 315.96. And when you put them together, it's 1,295.14. 98.5% of your claims were network. Your medical spend for this period of time, January 1st through the end of December, was 6.7 million, and your pharmacy spend was 2.1 million.
Now that's exclusive of any discounts? Is that what the total out-of-pocket spend was for medical spend and pharmacy?
That includes the discount amount. This is what was paid. So not necessarily what was billed. This was what was paid.
Through Anthem.
And Carolyn, the prescription vendor.
It's tough to break down the general fund cost, even though I have an idea, because you just look at the premiums, but our premiums went up. But this is the entire county as a whole. So
So then, if we look at the next page, the graph chart, the lighter blue is the current period, meaning January 2022 through December 2022. Darker blue is January 2021 through December 2021. And the green is January 2020 through December 2020. So that you can see inpatient is the lesser for 2022 of the previous 2 years. Your outpatient is greater. And your professional has stayed fairly steady. Your pharmacy is less this year than it was last year, but greater than it was 2 years ago. So if we are looking at the current period, inpatient is 89.92, outpatient is 235.45, and this is per member per month. Professional is 132.45, and that is what matches your 457.82. If we flip over and we're looking at your membership by paid claims, pie chart, percentage of enrollment is 46.8% for employee, and they make up 48.9% of the claims. 15.5% enrollment for spouse, and they make up 35.9% of the claims. And 37.7% enrollment for children, and they make up 15.1% of the claims. What I will say is we find this to be fairly consistent. Children, even though they might be a third of your enrollment, they are usually nowhere near that in the way of percentage of claim dollars. Traditionally, you'll see employee and spouse as far as percentage of claims being fairly close to each other. Yours might be a little less because of the requirements you have as far as spouse will on the plan.
Wendy, on page 3 at the bottom, their professional services, the graph shows this year higher than 2 years ago. The numbers do not.
Well, that may have to do with the services that are being rendered. The graph's going to show you the number of services.
That's not the dollar amount, that's the number of services.
But may have to do with the services being less expensive for the professional.
Okay.
Can you tell me what percentage of our employees are covered by our insurance?
I actually track that if you're talking about general fund. I can't track that outside, but ballpark speaking, if you're looking at general fund employees, Cliff, it's about 78% of our general fund employees have our coverage.
When you're talking about overall employees who are eligible for coverage, do we track that as far as who's covered and who's eligible for coverage? I don't for these reporting purposes, but when we do your ACA reporting, we certainly do. Rachel and Laura and the auditor.
78 close, 77.7 around there. That's why I have Rachel and Wendy every month send me reports
That's your general fund as far as where
Right.
they fall. I think what Cliff is asking of your total employees who are eligible for coverage, how many of them are taking?
Probably tracks close. I can imagine it's
I
that.
can get you that because
No, it's a-
we just did your ACA filing. So we actually have the actual number of who was eligible based on the ACA qualifications, took insurance. And I could get that to you.
Sounds like probably pretty accurate.
It's probably close.
Okay, if we're looking at the chart below, it is comparing membership. The lighter blue are females and the darker blue are males. And that's just so that you see where your membership lies. Currently, right now, the age tier with the greatest membership is males between the ages of 15 and 24.
That's some pretty close shades of blue there, Wendy.
They are. Oh, no.
I mean, you couldn't do like a red and blue. I mean, you had to be like blue and somewhat like the blue or.
I believe these are directly pulled from Anthem and, let's go, Blue Cross Blue.
That's
Shield.
genius.
We're gonna lose a lot of.
A trillion colors. They're like, let's go blue and sort of looks just like it blue.
They knew you were Duke fan.
Yeah. At least not Carolina blue.
So then we look at the next page, and once again, you're looking at two shades of blue.
Apparently Anthem only has blue in their color Rolodex or what do they call that?
Well, I get it,
Panel.
Cross Blue Shield. You're
Right.
gonna see a lot of blue.
All right.
Michigan by any chance?
No, Anthem's not. Anthem is based in Indianapolis, Indiana.
Oh, cool. Okay.
So you're looking at the chart. The lighter blue is the current spend, and the darker blue is the previous year's spend. And you can see they all run pretty close. About 58% of Richland County's membership have claims less than $1,000, and about 13% of your membership have claims under $2,000. So the majority of the dollar spend is with a very small percentage of the population. When we're looking at your high cost claimants, your high cost claims, and those are claims over 50,000. I just need to feel like I need to say this. You don't have to have a significant situation to have a $50,000 claim. You can have an outpatient surgery and have a $50,000.
Like a hangnail in today's inflation.
We use 50,000 because of where our pooling points are within Subco, that we have very low pooling points. If you were to go out and leave Subco and go in the open market and looking at where your stop loss point would be based on your size, it would be significantly greater than where Subco has put you. But we use $50,000. So looking at this, your high cost claimants make up 49.1% of your dollar spend for this time period. They make up 3.3% of your total enrollment. And you had 40 members that had claims over $50,000. Total medical spend for the high cost claimants was 3.3 million. The total prescription spend was 1 million. The total spend for the county was 8.8 million. And if you flip to the next page, loss ratio, you can see that it was your prescription loss ratio that was tipping you into above that 100,000 range. And what I'm going to tell you is that's not inconsistent with the Subco member counties. Prescription is the one variable that we do our best to project, but it's one of those things that it confounds us what the cost of prescriptions really are. If you had told me 15 or 20 years ago that there are generic medications that are $700 a month, I would have not believed it, because in our minds, you're thinking of generics being, $4 or $5 or $10, but that's not the case any longer. If you had told me that there would be some specialty meds that are running $35,000 a month, I would have found that hard to believe. And there are some that run higher than that. And we have, the Subco team recently attended a pharmacy seminar that made us very nervous about what's coming in the pipelines in the near future.
When you say $35,000 a month, what does that mean? That's not for an individual person.
county is paying, for example, if your copay for a 30-day spend for a single source brand is $70, that means the county is paying $34,930 for that medication.
Per month.
Yes. There are some medications in the pipeline that are going to hit the market in 2023 that are going to be life-changing for some people, but very expensive. There is a medication that is due to hit the market, probably late summer, early fall, that will be truly genetically, if you have the right genetic markers, it will be a cure for hemophilia. Now, there'll need to be testing to be sure that you have the right genetic markers, but that medication may run more than $1 million. But it is a cure,
There's no generic for that?
not now.
That is life-changing.
It is.
There are also some,
Four cousins that have.
There-
Series.
That is unbelievable.
what we need to look at with medications is a lot of it is a cost shifting from one place to another. If you're on some of these very costly medications, you're seeing the dollars being spent in pharmacy. You're not seeing it being spent in the hospital or hospitalizations. But going back to the hemophilia, let's just look at it in this manner. If you have, it's hereditary, and if you have the genetic markers, and you have 2 children that have hemophilia, and they're telling you that they have the right genetic marker and this is going to cure them, that they can have a normal life and not have to be restricted in their activities. I mean, for that family, it seems.
You can't, obviously you can't put a price on life and quality of life. I think we all get that. But yet much of what we're talking about today is obviously cost to the taxpayer, right? So what drives let's say people are just watching on TV right now. I mean, what drives the cost of $1 million per prescription? And then what are mechanisms that can ultimately be put in place? And I know we're capitalistic free market society, so I get that. But I mean, if you don't have insurance, how do you?
You don't have insurance, you're
Right.
probably not going to have the access. to it.
What? It's $1 million for that prescription.
I think it's a 90-day to 120-day course of treatment.
So that's 90 days. It's 3 months, technically 31 and a half days a month if you break it down. That's 1 million times 4. That's $4 million a year.
No,
Or just,
no, it's the million for the full course of the treatment.
okay.
That's all.
Yeah.
We only have to do it once.
Now, yeah, so that's my next question. They have to take how often they have to take the treatment?
Once. Now, there are a lot of questions that carriers are going to have when this is introduced, like if they meet that genetic guideline and we choose to we cover this for you, but it doesn't cure them, what kind of rebate is that prescription carrier going to give back?
Should come back from pharma,
That's what I mean. What
right?
kind of rebate are we going to get if that really didn't cure?
Of course, then they say then pharma's got to carry some sort of insurance, and then that raises the cost of the price on the front end, and it's.
I will tell you, look, on the back end, we have stop loss. And stop loss is definitely looking at some of these, saying that they may want to laser out around some of these prescriptions. So, those are all things that have to be considered. Number one, when it says it's genetic and you have to have certain genetic markers, you better believe on our plan, you're going to have gone through all of that testing before we're going.
I would imagine you can't get the script until you go through the testing though, right? I mean,
I would hope, but I don't know for sure that all physicians are following that protocol, but I know that under our plan, we have pretty strict guidelines on medication. Some of your members, I'm sure, have bent Rachel's ear on some of the prior auths on some of medications that are not that costly, that just my doctor wrote it, so I should be able to get it. nope, nope, nope. You have to meet certain criteria. to
And
get-
it's not, and right, not all doctors are gonna know every plan's prior authorization procedures, so. You know, there's probably some pretty, like this one, you would think most, if not all doctors are gonna know about the genetic marker
Yeah, I would think.
requirements. I don't know if that's gonna
Well,
be.
I would think on this one, yes, because
Right.
if you're,
Cause you can't get, right,
if you're a doctor who's treating a patient with hemophilia, you're going to be aware of this medication and you're going to be aware of some of the criteria for it. But we have medications that, I mean, that members want, and we have criteria for them to have. And I guess what I need to say is that criteria is not just an arbitrary, it's based on what the manufacturer is saying criteria should be met. It's based on sound medical reasons that the one that comes up right now, I'll be honest, is the one that people are not happy with all of their carriers on because they want Ozempic. Well, Ozempic is for type 2 diabetes. You do have it on here. But it has been used off-brand and it's been in the news with celebrities. Celebrities are using it for weight loss.
I saw that. That's what, okay.
So you can't get Ozempic on our plan for weight loss. The only way you're going to get Ozempic is if you're a type 2 diabetic. And your doctor is attesting that you're type 2 diabetic and these are the things that you're on. But you're not going to get it for weight loss on our plan. Now, you may choose to pay for it on your own and not run it through insurance, which I'm sure and celebrities aren't.
Healthy though.
Would a doctor write a prescription for that?
In Hollywood,
There is a,
Michael Jackson's doctor.
Again,
there is a prescription. A doctor can write a prescription for it.
for weight.
Yes, there's lots of stuff out.
And I'd be worried as a doctor.
Lots of stuff out there that will tell you that this is not healthy for you to be on if
Sure.
you're not a type 2 diabetic.
So of all these medications listed here, are there not generics for each? For each of
Not currently,
them? All right.
They get a 20-year patent or
usually
something.
7.
So this is a little bit off topic, but speaking of genetic markers, I had dinner with a couple of doctors Saturday night. Mentioned that there's going to be a game changer coming in the next year. It'll be a blood test for 20 specific cancers based on genetic markers. So it'll test for prostate and liver and pancreatic cancer well in advance of any kind of test that are now. So not knowing the cost of that is something like that, which clearly preventative. Would that be covered regardless of cost? It's based on genetic markers.
I can't say it'll be covered regardless of cost. We need to know more information on it.
Maybe.
He was very optimistic though. It's game.
We need to, I mean, there needs to be more if it's within a certain reasons. Will cost, yes. And of course, Anthem and any carrier is always working to negotiate the discounts and to get it better. But if you're saying that this blood test came down the line and it's 50,000 and physicians are urging that everybody take it, that's a dollar amount that a health plan probably can't sustain.
Our current plan has criteria to meet. My doctor questioned about testing me and the plan denied it because I wasn't old enough. I didn't have 3 women on one side. They were split on 2 sides. So currently there is criteria to get
Certain testing.
certain testing.
There is.
So I
Even
would
if it's
assume,
preventative, clearly.
I would assume if that comes out, you're gonna have to have some sort of history in your family for it to be covered. Now you can choose to pay for it, of course.
Right.
But when my doctor tried to get it approved, it was denied because of, like I said, I wasn't old enough and I didn't have 3 women on one side.
If this becomes more common though, you'll probably see this is still,
Criteria will change.
it'll loosen.
Yeah. Those are all things that we grapple with every day when we're looking at, we want to provide good coverage, but we need it to be affordable for the employer, be able to provide that coverage. So, on your pharmacy, your number 1 medication by dollar spend is the Humira pen. And I didn't go into the descriptions of what these medications are for. And part of that has to do with, based on PHI, we decided we would not provide those on a longer. We would just indicate the dollar spend, what those medications are used for. A single prescription, 30 days is $3,642 for that. The number two spend is for Tasigna, and that is a single prescription is $8,489. And the next is Trulicity. For 30 days, a single prescription is $1,866. Number four is Ozempic. A single prescription is $1,393. And the most expensive medication by dose is for Stelara. A single prescription is $8,159. Realistically, if you watch television commercials, you'll know what these are for, because every single one of these, other than maybe Tasigna, is advertised on the TV frequently. And they may have cross uses. There are some that were, the research on it was for this, but then they found that it's also beneficial.
Cigna's cancer, right? If our commercials.
Cigna?
Yeah.
Multiple sclerosis.
So this dollar cost you have here, $3,642. That's the total cost for the prescription, including what the employer pays and what the employer pays,
Total cost.
total cost.
So when we look at your top 10 by dollar spend, these make up 48.3% of your total spend. They represent 290 prescriptions out of your 14,703 prescriptions. So the majority of your prescriptions are probably generics running a couple dollars. We go to the next page, we're looking at kind of the breakdown of how to handle. So the majority of your medications are being purchased at retail. Of the 14,705, 13,665 are being purchased at retail. And of those, 11,990 of them are generic. You have 1,038 that are being purchased through mail order. And of those, 812 are generic. So the majority are clearly generic meds. And if you flip around, I've put together the pie charts that kind of shows you by the paid amount and by the script.
If I can make an observation, looks like clearly most of these are maintenance medications,
Probably.
unique claimants.
Most of them are maintenance, probably. With the Maintenance 90 program that we introduced in 2022, you need to, if you're on a maintenance med, you must be filling it in a 90-day fill. You have your choice. You can fill it in a 90-day fill through home delivery or mail order, or you can go to CVS, Walmart, or Kroger to fill it. And there's a whole reason behind that, that every time you fill a medication, what you don't see behind the scenes is a dispensing fee. So number doesn't see that in their copay, but that is included in the cost. So if the vast majority of the medications being filled are maintenance meds, we can save 2 dispensing fees. That's a significant savings. And it
Not up to the physician though. Isn't the prescription indicating 90-day, 60-day, 30-day?
well, but
For the doctor to indicate how long the prescription's for?
your plan requires on a maintenance med that the physician write it for 90 days now. That's very common. Most carriers.
The patient's responsibility to tell the doctor.
Yes. Yes, it is definitely the patient's responsibility to tell the doctor, my coverage
90 day.
requires the 90-day, and to let them know, call the prescription in to these pharmacies or give me the paperwork so that I can use mail order, or you get it to mail order. When we introduced the program in 2022, we gave you 2 courtesy 30-day fills and you got letters. The first time you filled it, well, if you were on a maintenance med in 2021, you got a letter indicating you were going to need to fill this in a 90-day fill. First time you filled it for 30 days, you got a letter indicating you have 1 more courtesy fill. Then the second time you filled it, you were told you have no more courtesy fills for 30 days. You need to move this to 90 days if you want insurance to cover it. We saved a significant amount of money. And this is all about trying to allow counties to provide a good benefit without having to raise your copays and without having to, for us to have to go to a restricted formulary.
Health insurance, which includes script on our premium side, makes over 10% of our general fund expenses. And if you include payroll, and by payroll, I'm talking Medicare payroll, because I think that's about the closest bullseye you can get to what we spend on payroll. Health insurance premiums and payroll alone make up nearly 65%, which makes sense, but I mean, that is our general fund expenses. Should be people. Those are things I'm looking at on a cost side.
It is a valuable benefit that employees forget that this is a benefit to you, that your employer is providing, that is a very valuable benefit.
And it's something oftentimes when people look for new jobs, they don't take into account the true cost. What's your pension contribution? What's your healthcare coverage? There's one high-end claim, if you move to a job that's better paying with worse benefits, is it wipes away, you're working at a negative. So whenever we always discuss that with people is when you're looking for new jobs is what's the total cost of your benefits and salary when looking for a job.
Well, if you look at the pie charts of the prescription, the first one is by paid amount. And you can see that the dark blue that is most of the pie chart is retail single source brand, which that means is there is no other source, there is no generic. And the bottom one is by the number of prescriptions, and the large blue there is generic retail. Meaning the majority of the prescriptions are generic, but there might be multiple generic, but the dollar spend is on a single source, and falling into those single source are those specialty meds that are in your top 10. Then if we look at your facility utilization, your top dollar spend for inpatient facility is at Arthur James OSU. And a number of the facilities are listed more than once. And this has to do with facilities using different cost centers, depending upon the floor or department that's rendering the service. So when they appear on this report, they may appear multiple times because of how they are billing Anthem. But we've gone through and determined, taking if they're, for example, Arthur James is on here more than once, taking that multiple times and adding up the dollar amount and realizing your top dollar spend is at Arthur James. Your next top dollar spend is Ohio Health Mansfield. And most utilized facility is, of course, Ohio Health Mansfield. There were 37 inpatient admissions in 2022. And if we flip over, we look at outpatient, your top dollar spend in most utilized facility for outpatient services was Ohio Health Mansfield. There were 587 claimants with 2,349 services. And then we're going to look at the discount. Kind of one of the reasons why Anthem remains our medical provider. On your facility, inpatient, the discount's 37.7%. So on the covered expense of $2.1 million, $822,000 was discounted off. On outpatient, your discount is 34.2%. Professional, it's 57.6% for a total discount of 43.8%. And then I've given you where I pulled a lot of the graphics. And then you have a page that looks like this. That summarizes for you what you have paid on the claims under medical, prescription, and then together, and then what the billed premium was for medical, prescription, and medical and prescription together, and then your dental. And then it also is compared you so that you can see where Sevco overall stands. If you flip the page over, it gives you your average enrollment, and then it gives you your high cost claimant report. Your pooling point is 125,000 with Sevco, and you had eight claimants and over the 125,000. If you remember how Sevco works, any claim that's over 125,000, the county is responsible for that first 125, but anything above that, the pool absorbs for you. For example, you had a $338,000 claim. You were responsible for 125. Subco took over the rest of that in the pool. Any questions on anything I've covered? Our annual membership meeting is. I know we have a couple people from Richland County that have sent their RSVP, but if you would like to, you can still send your RSVP if you're available to attend. It's at the Embassy Suites at the airport in Columbus. We'll be going over a lot of data and a lot of kind of things that we see direction that Subco may be going on some things, the next couple of years are going to be very interesting in healthcare.
Message to employees is to maintain a healthy lifestyle. If you don't have one, get one. Play more tennis. I think that would be my recommendation.
Well, I'll tell you the thing that alarms us is the large percentage that we feel of people that do not have a primary care physician and have not been to a physician in at least 4 years. The main thing with our wellness program that we push is have a primary care physician and do a biometric screening once a year. And hopefully you're sharing your biometric screening with your physician, that you're discussing where you can't change what you don't know. The numbers tell you where you are. If there are areas for improvement, you should be having that discussion with your physician.
What results back yet? I was just thinking about that there. I'm gonna go in and check. I was just thinking about that as she came in here. I go, I didn't check for my blood test. So I got to share that with my doctor.
Mhm.
We first got here 6 years ago and worked on it since. One of the things that we were spending so much money on emergency rooms, especially on Monday mornings. Have we improved that?
It improved significantly before COVID. It is not as high on Monday mornings as it had been, but emergency room usage is up higher than we would like it to be. But it's not anything that we feel is totally controllable now, because people are still nervous about COVID. And if they call their physician and feel that they have COVID-like symptoms, often they're directed to go to the emergency room. So that's something that the unique situation we're in right now, we can't really control. It is nowhere near what it was, 6 or 7 years ago, but it is higher than it had been. And you understand that people are scared. Hey, if I have it, I want to find out and I want to get the medication and,
Now we got Paxlovid.
right. But, it is what we would like people to use the other alternatives in the emergency room. There are alternatives, but I do understand that if you're having symptoms and your doctor is telling you to go to the emergency room, you need to go to the emergency room if that's what your doctor is telling you to do. Emergency room is expensive care. I mean, if you're equating it out, you're going to your primary care physician, you're going to an urgent care, or you're going to emergency room, where you maybe could get into your primary care and he would be seeing you, and the whole bill might be less than $200 if he ran tests and whatever. Emergency room, you're probably not getting out of there for less than $2,000. Any questions?
Being healthy and staying healthy has a cost, which you just outlined for us.
It does.
Greg, anything?
I'm sure somewhere in there, can you give me the total cost to the county that pharmaceuticals were and the total cost? Just to break it down a little bit easier for me.
Are you looking at paid claims or what they paid in premium? Two different things. They're paying a certain amount to Sebco in premium, and then there's a certain amount that's being paid in claims. In paid claims, pharmacy for the year, it was $2.1 million. In medical, it was $6.7 million for the year. If you put them together, 8.9 million.
So that
How does that compare to previous years? I guess is it increasing? Obviously, probably
It's
increasing.
increasing.
Do you have like a
How much? Percentage wise?
I'd have to look up specifically for the county. We know that medical trend 7.5 over the previous year. And we know that pharmacy is a little higher than that. So our pharmacy, overall, what we're spending, maybe not individually with the counties, but we're doing pretty well with the programs that we've entered into. But those are, I mean, you certainly have member noise on it by going into the maintenance 90, by aggressive prior auth. We also have a program, the cost relief program, that people ignore the letter when it comes to them from the insurance carrier. This is a program as manufacturers have rebates and have discounts available that you can choose to take advantage of or not. And we are choosing to take advantage. If they are offering a discount arrangement for a medication, we want to take advantage of it. And these are some of those higher cost meds, very much like the ones that are on your report. If that manufacturer is offering a significant discount, and usually what the discount is zero copay for a period of time, we notify the member, or not we, but Carillon, previously their name was Ingenio, but their name is now Carillon, sends a letter to the member indicating you're on X number of X medication, and this is eligible for the cost relief program. Please contact us so we can enroll you in the program. And the letter can be a little frightening. If you do not enroll in the program, the cost of your medication may be, and it's a significant dollar amount. It's not your copay, it's the significant dollar amount. I cannot tell you how many people ignore that letter. They don't call, they don't do anything. And then they go to get the medication. And if you have a Richland County person, they call Rachel extremely upset that they've gone to get their medication where they previously were paying a $50 copay, and they're now being told your medication is now $2,300 a month. And Rachel's familiar enough. I think you got a letter about this. They can at that point contact Carillon and get in the program. And all of a sudden they go from paying a $50 copay to zero. And likewise, the savings is passed along behind the scenes to the county. You're not paying what you're used to. But along with this, we let them know the manufacturer could pull back this program at any moment. They could say, yep, this is over. And then it goes back to the normal copay arrangement. But the member has to agree to be in this program. So, you know, we haven't anybody disagree to be in the program once they understand how it works. But actively, most people ignore the letter when it comes. They just don't do it. They don't call them. They don't enroll in the program. They let it go.
No, it's got this big dollar amount in it.
Yes,
Just ignore it.
absolutely. They said, why, you know, they usually say, well, I didn't think it applied to me. I thought all I had is my $50 copay. What? Well, it's coming from your carrier telling. But this has saved us. We've been in this program for about 18 months, maybe a little bit longer. It's saved a significant amount of money. But as I said, this X medication may be on the program, but next year they may not. The manufacturer may have said, well, I'm not offering that discount any longer.
There are people that's wondering if the care growth that Adam Gove is doing is we're paying for that. And I want to assure him that we are not. And obviously, it's not working well.
Carl, anything? Any questions?
Yeah, real quick, with the 100.4 cost loss, at what point does Sebco will it happen at the annual meeting where you'll look at rates that are being charged to counties?
We already got dinged for that on a 6.6% premium increase, Carl.
Yeah, the renewal won't be until next
Right.
fall. Your time frame that we look at for renewal is July through June. So what you have here is you've got 6 months of what your renewal is going to be based on.
Oh, they get their increase, Carl.
So, well, you need to look at your history. You had many years where you had no increase.
Yeah, we did.
So
Yeah, we have several years. Now it's 6.6.
what I've got to say though is, I mean, a lot certainly has to do with the program Sebco has put into place, but by and large, the majority of Richland County employees are informed consumers. When we explain how you can save money on your out-of-pocket expense, they've embraced it. I mean, they really have. They know, well, if I go here, this is going to save me out of pocket. I don't know. I wish I could say that they would love to do that because they're saving the county out of pocket, but it's usually we're saving you out of pocket, but that also saves the county. The big thing like lab is the one that we always talk about. There is a huge difference between where you have your lab services done. Anthem has a special contract with LabCorp and Quest. It's called a reference lab contract. So behind the scenes, if you go to LabCorp or Quest and you have a PPO plan like Richland County offers their employees, regardless of why you're having the lab, if it's a covered lab, there is no out-of-pocket expense for you. It's going to be paid at 100%. Whereas if you have those same labs done at Ohio Health Mansfield, it's going to be subject to deductible and coinsurance because there is no same thing. But if you're looking at dollar expense, members are looking at what's coming out of their pocket. Behind the scenes, what we look at it for the 30 most common labs that are ordered. If you're going to LabCorp and Quest, the bill is probably going to be less than $40 with their contracted amount with Anthem. You have those same 40 labs done outpatient at a hospital, and the bill is going to be about $400. So it's kind of, to me, it's a no-brainer. I pay nothing out of my pocket if I go to LabCorp or Quest. If I go to outpatient to hospital, I'm going to meet my deductible and I'm going to have coinsurance amount. But behind the scenes, what is going to go on is the county is going to pay $40 for a lab, or they're going to pay $400 for the same lab. And if every single employee kind of paid attention to that, the savings is phenomenal.
Well, I'm just curious. Can you see how that could be confusing though? Because if you are a county employee, Ohio Health is a facility that's in network. But if you get lab work done there, that's not covered.
No, it's covered. It's subject to deductible and coinsurance.
But
It's covered.
But I mean, I guess the question is it confusing for employees because they have to go someplace else to get lab work when they're thinking Ohio Health is a covered or a facility that is in network and therefore.
I don't think it's confusing because we do a very good job at the open enrollment meetings explaining this. And we have done this from day one, from once Richland County joined Sebco. We've gone over this. And I know Rachel, when anybody calls her, she's very quick to tell them, well, you know, if you go here, you have no out-of-pocket expense, you can save money. So if you never attend an open enrollment meeting, then maybe you would be confused. But in addition to the open enrollment meetings, last 2 years, we've done videos that can be rolled out to the employees. And in that, we always mention this as just a real simple way to save money out of your pocket.
Okay, and in terms of informed members, what what's the percentage of members who participate now in the wellness plan? And is that number trending up or down? And I apologize if you talked about that earlier.
I did not talk about that. I think for 2022, you were a little below what you had been in 2021 for
Yes.
participation. It still is a greater percentage of your employees are participating in the wellness, but off the top of my head, I don't have the percentages. I do know you probably know in general fund based on what I send you, but
Rachel and Wendy get tired of me asking for those monthly figures. They usually beat me to it, but I'm constantly tracking our healthcare expenses in relation to total expenses, numbers. That includes OPERS, Medicare. I'm kind of looking at our fringe benefit costs, Carl.
you're,
Sorry, go ahead.
I would say across the board for all of our counties, we've seen a little bit of a trending down in 2022 on wellness participation. And we also are attributing that a little bit to the COVID impact. People just not paying as much attention. We're seeing a little bit better on this year. We saw certainly an uptick in participation when they've come on site to do biometric screenings in the various counties. I don't know if you saw heavier participation than you have in the last year.
Yes.
But we can
Just-
certainly, go ahead.
No, I'm sorry, go ahead.
We can certainly get the actual percentage that you have participating at this point for 2023 and what you ended up 2022.
Okay, thank you. And for the commissioners, just remind me, what's the dollar amount that the county put in the general fund budget for healthcare costs for this year?
Hold on a second, Carl. I'll get that for you. Now, it's not gonna be, so we spent in 2022, Carl, 3,871,627.28. If you figure in a 6.6% increase, that's around 4.1 million. It's not going to be spot on because obviously it's based off how many employees you have. So I would say we plan to spend approximately 4.1 million in just health insurance and prescription, with the caveat being that could fluctuate based on enrollment.
But it's close to 10% of our.
Yeah, it's over 10%. Well, if you look at that and you divide it, let's see here, we're at 41.9, which is what our appropriations were. That's about 10%. Around that 10% mark in health insurance and prescription costs of total general fund costs.
And I guess to the best of your recollection or knowledge, is that percentage going up, down, or staying flat over the last few years?
Well, you gotta remember, now we're getting into more weeds here. That's appropriations. If you truly look at expenses, and we hope our expenses will be less than what we appropriated, then it'll go over that. That 4.1 is gonna be close, Carl. So I'm not trying to be evasive here. But I expect when it's all said and done, our health insurance and premium costs will exceed 10%. That's just beginning of the year appropriations. So last year, if you look, again, we spent to the penny 3.3871627, and our true expenses were 37,001,391. So that's over 10%.
There are a couple other like cost savings things that we do have a program that's called Smart Shopper. And we're into our third year. And I will say Richland County employees have embraced this program.
Absolutely.
This is something that you have to do ahead of time, for something that you know that you're going to have done ahead of time. Maybe you've been you've had a problem with your ankle and, your doctor has been having you do a little physical therapy and it's not getting better. And he said, I think we really need to do an MRI to see what's going on. We encourage call Smart Shopper before you schedule the appointment someplace. Tell them exactly, they're going to ask you your information as far as off of your identification card, where you live. They'll also ask you how far you want to travel. Are you willing to maybe leave right where you live and travel a few miles? And then they're going to give you some options as far as where you can go to have the MRI. And they may say, well, if you go here, it's going to cost this. If you're going to go here, it's going to cost this. If you go here, it's going to cost this. In addition to telling you what it's going to cost, they're going to give you the quality on those providers, and you make your decision. If you elect to go to one of the ones that's more cost savings, they're going to send you a check and they're going to tell you right then and there, would you like us to assist you in making the appointment? So they can do a 3-way call right then and there with your calendar and theirs to set up the appointment for you. And they will tell you, if you go here because it's saving this much money, you're going to get a check for X number of dollars. The checks range between $15 and $500. So it's just, we're encouraging and we are willing to share what we're saving behind the scenes because it's encouraging and getting a mindset that you can compare costs on your health insurance, that you don't have to just determine, I've got to go here and that's the only place to go. Certainly this is in coordination with your physician. If there are certain things going on that you really can't change where you're going, that you're under a treatment plan and it needs to be at a particular facility, that maybe isn't this. But for some of those things that you know ahead of time, it's become a very popular program. And I can tell you, whenever I do open enrollment meetings, there's always somebody who wants to stand up and share that how great that this program was, because in many cases it's covering your deductible. So
To have options, good to save money.
And also for blood work, if you call into Smart Shopper, let them know I have to have, just a normal panel completed. They'll give you a couple of options, but in this area, of course, it is LabCorp, and they'll ask you, do you need us to set up an appointment? No, we can do walk-ins. Okay, we'll send you $25. You're getting your screening for free, and you're getting $25.
yeah, you
Better
can
is that.
use this for any preventive care service that you're doing. I mean, any of the mammographies, the mammography is a big one that many of our email members use it for mammography. It's just, it's encouraging you to be aware of what things cost when you go to various facilities. You may not have it as much, but there are some areas that have competing hospitals, and there can be significant dollar difference between a service at this facility and a service at that facility. So just kind of making people aware that there are very, very much fluctuations in what things cost between who the provider is.
And your provider will always gently push you towards the hospital that they use. But that doesn't mean you have to use them. You have the right to go outside the hospital to have this.
Well, one of the things that's been the changing landscape in healthcare in the last 15 or 20 years is the change in physician practices. 15 or 20 years ago, the physician practices were independent. They weren't owned by anybody. They weren't employees. Now the majority of physician practices are owned by the hospital. And part of that is that they are to direct their patients to the hospital for services. That's just a matter of life. So we're aware that we sometimes need to circumnavigate that in order to get some savings. Outpatient, when you're doing your lab at the hospital, it's being billed as an outpatient hospital service. When you're doing your lab at LabCorp, it's being billed as a professional service, and there's a distinct difference in the cost structure. If you're doing your lab outpatient hospital, it relies on what that outpatient hospital contract is that that hospital has negotiated with the carrier. So it can very much differentiate between, it may even differentiate within the Ohio Health Network between having your lab services done in Mansfield and having it done in Marion, or having it done at Riverside, depending upon what the negotiated contract is for those facilities.
Anything else, Carl?
Nope, that's it for me. Thanks.
Okay, have anything for us, Al?
Yeah, Wendy, you mentioned, excuse me, earlier that the use figures and everything for Richland County are similar to, and kind of in the middle of SEBCO members.
Not use membership, the membership numbers.
Yeah. But I mean, you say I'm sorry, what were you saying? The participants were similar, or the cost figures?
Not the cost, the actual membership, the demographics of your membership. For
Okay,
example, where your 53.7% of your membership is female and 46.3% is male, that's fairly in the middle of SEBCO. And then when you look at the average employee age, 47 years, 9 months for female and 45 years, 2 months for male, that's kind of right in the middle of SEBCO for actual average employee age. So you fall kind of smack dab in the middle of the 46 counties in SEBCO, not necessarily in your usage or your claim dollars or your prescription, just your actual membership.
okay. All right, then that prompts my next question. Without necessarily giving any particular figures, how does Richland County compare in expenses and claims to other SEBCO? And in terms of dollar amount, how would that compare to the average population?
It's hard to extrapolate that because it has to, we have counties that are 100 employees and we have counties that are 1,000 employees. So if you're talking about counties of a similar size to Richland, you're probably have a better loss ratio than counties of a similar size, at least for the current time frame that we're in. But if you put it overall, it really doesn't, there's not a lot of value in comparing your loss ratio to 100 life county.
I guess the reason why I'm asking that question is, I'm looking at it, are county employees better off, say, than the average person in terms of how they're benefiting from their insurance?
Well, your benefit plan is probably much richer than what the average person who's in the private sector's benefit plan is. As far as what their maximum out-of-pocket exposure is compared to somebody who's in the public sector or the private sector. Most people in private sector at this point are now in high deductible health plans and they don't have copays. They have a high deductible that they need to meet before anything's paid. So certainly that's very different. And that, honestly, that's a really great benefit with being a public sector employee, is your benefits are usually richer than what's out there in the private sector.
Okay. For SEBCO, are the costs, cost increases and changes similar to what they are for private sector, or are they different too, simply because of those differences?
Ours are a little bit lower, honestly. When we look at our actuary, looks at what's going on overall, and then they look at what's going on in SEBCO to come up with what they pay attention to medical trend that encompasses all of the United States. And then they look at medical trend for SEBCO and then regional medical trend. And we have been below the actual medical trend, and Subco overall has been below the actual medical trend. I know the 6% renewal that Richland County received was still below medical trend. So
What is the national trend? You know,
I don't know at this point, but at the end of, the most recent renewal period, it was 7.5. So we'll be looking at some preliminary slides before the membership meeting. I'll have a better idea where medical trend is running right now and where we are, since we're 6 months into and almost 9 months at the point of the membership meeting into what the renewal period will be. It'll be interesting to see where we feel we're falling at this point. January was pretty good. February, not so great. And we, of course, haven't seen all March data yet. But you can, looking at your report, you see your first 6 months of your utilization.
Okay, the other question I had, would somebody be able to send me a copy of the stuff you've been going over with the commissioners, not only the multi-page, but that one sheet that kind of summarizes?
I
everything
always
too?
save them. I'll do that when we're done with all the meetings, Al and Carl.
That sounds good to me, Tony.
I'll
Thank you.
send it to you electronically when I get back to the office.
I always go and scan it anyway, so you don't even have to.
There's something I don't want you, that I've given you, that I want you not, that I need to alter for you. It's the loss ratio. Look at the loss ratio.
All right, we can talk offline.
any other comments or questions from anyone here, including online? Okay. Wendy, thank you so much. Rachel, thank you also for coming and keeping us informed.
Thank you.
Thank you. So we've been here a little over an hour. You want to keep going? Or you want to take a 5-minute break?
Let's take a quick, so I can talk to Wendy as to know what she's saying.
Okay, let's break till, we will recess until 10:45.
Play on the football team next year?
It is 10:45. The Richland County Board of Commissioners is back in session. Following our review of SEBCO, we will have the first order of business to certify the record of proceedings for March 16th.
So moved.
Commissioner Mears,
Yes,
Commissioner Banks,
Yes.
Commissioner Vero.
can I have a motion to approve requisitions?
So moved.
Commissioner Mears,
Yes,
Commissioner Banks,
Yes.
Commissioner Vero.
yes. I have a motion to approve the sheriff's contract with the Village of Lucas for police services.
Second.
I'll let you have the next one there.
Commissioner Mears,
Yes,
Commissioner Banks,
Yes.
Commissioner Vero.
yes. I have a motion to approve the sheriff's contract with Solid Waste Authority for police services.
Commissioner Mears,
Yes.
Commissioner Banks,
Yes.
Commissioner Vero.
Yes.
Can I have a motion to authorize the engineer's agreement with ODOT for the replacement of the Marion Avenue Road Bridge? But before I ask for a motion, Adam, do you have anything you want to add for this?
Just real quick, this is the Marion, did you say?
Marion Road, yeah, Marion.
Okay. This will be funded at 100% through the state funding being administered by the County Engineers Association of Ohio and ODOT. They will cover 100% of the design and construction up to 1.175 million.
So moved.
Second. Whereabouts on Marion Avenue is it?
So this is about 200 feet south of the intersection with Millsboro West Road.
The cost to Richland County is like here.
Correct. We will have to do, have a contract for the construction inspection. At a later date.
Commissioner Mears,
Yes.
Commissioner Banks,
Yes.
Commissioner Vero.
Yes.
Next item of business is to authorize an engineer's agreement with ODOT for the replacement of the Town Line Road Bridge. And before we call for a motion, Adam?
Same thing, funded through state funding, which is actually, both of these are part of a new program that was developed as part of the bill, bipartisan infrastructure law, monies being filtered down to the states and then on to the county. Again, 100% covered design and construction up to a maximum of 685,000 for this bridge.
So moved.
Second.
Commissioner Mears,
Yes.
Commissioner Banks,
Yes.
Commissioner Vero.
Yes. I have one item for new business, if I may.
Absolutely.
And that's to authorize Richland County CSEA to offer one clerical specialist position. Offer a candidate. Specialist position.
So moved.
I will second that. That will be that.
Commissioner Mears,
Yes.
Commissioner Banks,
Yes.
Commissioner Vero.
Yes.
That concludes what's on the agenda. Are there any questions, Al or Carl?
Yeah, I've got one question. Adam, these two bridge projects, when do you expect them to be done?
So the Marion Avenue Road Bridge is a fiscal year 26. So hopefully towards the end of 25, maybe into 26. And then Town Line Road is a fiscal year 25 project. So again, that will probably happen calendar year 25.
Okay, are both of these going to require some detours?
Yes, they will have to be closed for the duration of their replacement.
Do you know approximately how long in each?
Not yet. Again, you were just awarded the funding, so we have not started design, but I would imagine it'll be somewhere between the 60 and 90-day mark.
Okay, that's all I had. Thank you.
Okay, thanks, Al. Carl, anything?
No, I'm good. Thank you. Oh, Tony, are you gonna be able to send that now that you've spoke with SEPCO?
Wendy's gotta go. It's gonna be a while. I spoke to Wendy. I understand now. We gotta have some things retracted as far as diagnosis for confidentiality purposes. So it won't be coming right away.
Okay, thanks.
Okay, any other business to come before the Board of Commissioners? Hearing none, the Mercer County Board of Commissioners adjourned at 10:50 a.m.
So I'm preparing my